Take your lightest loop band and your anti-burst ball. Set the band to the side and place the ball under your sacrum. Take your pointer fingers to the bony protrusions of your hips, guide them down for lumbar extension. From here, hug your right knee into your chest, sliding your left leg out long. Make sure that the heel is connected to the floor of the leg that's extended. You should have at least one arm on the ground so you don't rock off the ball. Guide your tailbone towards the bottom of the mat, accentuating the lumbar extension here. We're releasing the front of the thigh and the groin area, the hip flexors, which get tight due to work and travel. They're not a posturally tight muscle, which is why we only need 30 seconds to release them. Go ahead and switch sides, setting up on the other side. Take your time. Pelvic position is important. Back ribs and shoulders imprinting on the floor. Collarbone wide, chin retracted, all your checkpoints. Be cognizant. And one more inhale, brace the abs. Exhale, pulling the shin closer as you squeeze the front of the thigh that's extended. Go ahead and exhale. Lift the pelvis up and slide the ball out. Let's place that loop band around the arches of the feet and come to lie down supine again, elevating the pelvis to place the ball under the tailbone once again. Take the pointer fingers to the bony protrusions of the hips. Go ahead and guide them down. Couple of extensions here. So I'd like you to droop your tailbone over the ball, arching the lumbar, and then tip it back to neutral, inhaling. Exhale, arching. Inhale, neutral. Exhale, arch. Inhale, neutral. Just allowing your pelvis to work its knots out, getting into that lumbar, creating muscle memory for more extension. Okay, let's hold the extension. Pull the abs in. Exhale, let's lift our dominant leg up, dorsiflexing the foot. We're going to take it up for a slow 4 count. Take it up, 2, 3, 4. Lower it down, 2, 3, 4. Brace the abs. Exhale, lift, 2, 3, 4. Inhale, lower, 2, 3, 4. Continue on this side. I'd like you to think hard about your tailbone drooping down. Your dorsiflexed foot. Watch out for the foot just relaxing. You don't want to lose the band, and you also want to keep energy in the foot. Watch out for the pelvis. Make sure it's not tucking under. Is that ball high enough that you can arch your low back? And when you arch your low back, does your rib cage push forward? I want you to reach the chest towards the shoulder blades and imprint the shoulder blades into the floor. Finish up your last one on this side, setting the foot down and beginning on your non-dominant side. Dorsiflex the foot, exhale, lift, 2, 3, 4. Inhale, lower, 2, 3, 4. Slow and steady wins the race. Brace the abs. Exhale, lift, 2, 3, 4. Inhale, lower, 2, 3, 4. Keep this tempo. I'm going to remind you of your checkpoints. What's happening with the leg that's down? Where's the weight? Can we put the weight in the bone of the big toe by pressing it down like you're squashing a quarter with the bone of your big toe? This is going to help combat the supination we see with sway back posture. So balancing the feet and ankles will be essential to improve movement patterns. This will increase flexibility, build strength, to balance your legs out, to prevent injuries, and improve agility for sports performance. Doing great. Finish up your last one on this side. Once you have, you can kick that band away, lift the pelvis up, and slide that ball out. Good. So from here, we're going to place the ball between the knees. With the ball between the knees, we're going to do some bridging for the central glutes, the glute max and the glute min. Go ahead and bring your arm extensors down on the floor. We're going to do an exercise called marching, guiding the tailbone towards the feet. Feet are nice and parallel, hip distance apart. You're squeezing in on that ball with your tailbone reaching for your feet, and extension, and your arm extensors, triceps, wrist, and palms heavy, go ahead and lift your hips up high. Hold them here. Inhale, brace the abs and extend one of your shins. Inhale to lower it, brace the abs, extend the opposite shin. Inhale to lower it. And now from the upper back, mid back to tailbone, I would like you to lower down. So we're peeling down vertebra by vertebra, imprinting our back into the floor. Inhale. From here, brace the abs, tailbone reaching for the feet, press into the bones of your big toes and squeeze into that ball to send the hips up. This time, as you extend one shin, think about the bone of the big toe of the foot that's staying down. Keep your hips even. Lumbar extension, abs engaged. Inhale to lower that leg, switching sides. Bone of the big toe heavy. Chest reaching for the shoulder blades, abs pulling in towards the spine. Lift up on the muscles that stop your stream of pee. And exhale. This time, I'd like you to bring your tailbone down, bringing your torso down in one piece. So we're not peeling down from the upper back, mid back to low back. We're actually just lifting the pelvis up as if it was one piece. So take your tailbone back down to the floor in one fell swoop. So from here, we're going to switch into some single leg bridging. Extend your non-dominant shin out, still squeezing in on the ball. You can relax that foot that's in the air, but the foot that's on the ground, that bone of the big toe is heavy. Go ahead and press, press, press into that. From here, pick your torso and pelvis up in one piece, keeping lumbar extension. Pick it up, hold it in the air, press heavy into the bone of the big toe. Inhale one, breathe. Exhale one, staying up. Inhale, brace. Exhale, lowering that shin. Inhale, and taking the whole torso down in one piece, tapping the tailbone to the floor. Inhale, breathing laterally. Brace the abs, same side, lift it up, extending that non-dominant shin. Hold. Inhale one, breathe. Exhale one. Inhale two. Exhale two. Inhale. And lower the whole torso in one piece. Go ahead and switch sides, setting up for single leg work on your non-dominant side. We're going to want to do some extra repetitions here to try to balance out the strength in your legs. So what I'd like to see is the extension of your dominant leg in the air, relaxing the foot, squeezing in on the ball, and the foot that's down on the floor, that bone of the big toe is driving heavy into the floor, balancing the feet and ankles. From here, tailbone's reaching towards that foot. Well, not the foot, the bottom of the mat. It's staying centered. Palms are heavy, triceps are heavy, ribs are closed. Chin is retracted. That's a double chin. Brace the abs as you lift the pelvis up in one piece, holding it up. Inhale one, breathe. Exhale one. Bone of the big toe heavy of your supporting leg. Inhale two. Exhale two. Inhale. Brace the abs and exhale in one piece. Take your body back down. You're doing great. One more time. Inhale, prepare. Brace the abs, pick the pelvis up in one piece. Bone of the big toe is heavy. Inhale one, breathe. Exhale one. Inhale two. Exhale two. Inhale. And let's lower down slowly. From here, come to lie on your back with the anti-burst ball behind your head. Go ahead and take your right ankle to your left knee. Guide your tailbone down towards the bottom of the mat for a quick release. Inhale one, breathe. Exhale one, dorsiflex the foot that's crossed over the bottom thigh. Inhale two. Exhale two, pulling the hamstring towards you as you leverage that elbow to open the leg that's lifted, the leg that's on top and crossed over, the thigh away from you. Go ahead and switch sides. We're doing a quick release here. All that glute work. Those outer glutes, the piriformis, overactive, so it is posturally tight. We're going to get deeper into it as we continue to work, but I don't want you painting after all that glute, the glute bridging we just did. So you should be on the other side with the foot dorsiflex, tailbone reaching towards the bottom of the mat. Inhale one, breathe. Exhale one, close the ribs. Inhale two. Exhale two. And inhale. Brace the abs, exhale, coming out of this release. Good job.